Today we're going to talk about gynecomastia, a very common condition in men. And a lot of men just suffer in silence about it. They wear their t-shirt, they never take it off. Changing in a locker room is so stressful. And there's a lot of young men who are extremely fit, even bodybuilders, who suffer from this condition. So it's not necessarily due to weight gain. It's not necessarily genetics. A lot of people don't know the reason for it. And I can tell you it's pretty common. I see a lot of gynecomastia patients in all age groups. Usually it's a condition that appears in puberty when you are going through the hormonal changes of puberty. And in a few people, it subsides. Once you're completed with the puberty, it goes away. But in a lot of people, it does not. And it continues to progress and get larger. And it becomes even more embarrassing. And you know, being a teenager is hard enough. And having to change your clothes in locker room and being teased about it really undermines the self-confidence of a kid. And as a result, we usually recommend, if the gynecomastia has not subsided by 9 to 12 months, it's not going away. Usually with the teenage group, when hormones stabilize, within a year it should be gone. If it is not, at that point we recommend intervention. So it doesn't carry through their lives and make them embarrassed and make them self-conscious, hold them back from sports activities, from swimming pools, from parties. It's a very common condition that does that. So how do we treat gynecomastia? Sometimes it's an endocrinologist that sees these patients first because they think it's a hormonal problem. But I can tell you in 99% of people, the hormones are all normal. So there's really nothing to be done to manipulate the hormones to make it go away. So then it becomes a surgical problem. And we have very good techniques where we hide the incisions, where this is not a scar that you have to bear for life, where we reduce the amount of breast tissue, as well as liposuction around the chest to really contour the chest and accentuate the pec muscle. Incisions are well hidden in the lower border of the areola, which is the pigmented portion, and 2 small incisions at the border of the pec under the breast or chest in men. And with the combination of those incisions, we liposuction the whole area, smooth it out, and then take the small glandular tissue that remains from under the nipple areola complex. And usually you will notice that the size of the areola shrinks because the breast tissue that's under the nipple and areola really spreads the pigment and makes it stand out. And that's why when you wear a shirt, you can really notice it. Once that tissue is gone, the areola gets flatter and also contracts and becomes smaller, which is a very desired effect in most men. And what's involved afterwards? You usually have to wear a compression garment for about 4 weeks after the surgery, so the skin contours and sticks to the pec, so you can really see the muscle definition. There is drains involved if it's a big gynecomastia excision, and the drains usually stay between 7 to 10 days after surgery. The drain care is easy. We teach you or your loved one how to take care of it. And you can shower after the drains are out. And going back to normal activity in terms of exercise takes a good 4 to 6 weeks. Walking is allowed after the 2nd week, but we don't want any kind of activity that raises your blood pressure because it can lead to fluid collection there. And we really want that skin to shrink fast and you going back to life and forgetting about this operation. So take about 4 weeks of no heavy exercise. After that, you'll forget you had it and you'll be back in the gym, shirtless by the pool, and wondering why you didn't do this any sooner.